Now below dermoepidermal junction is dermis. Okay, now this dermis is made up of collagen, elastin and reticular fibers in the matrix of hyaluronic acid, dermatan sulfate and chondroitin sulfate. So there are three fibers which are mainly present here: collagen, elastin and reticular fibers. Okay, so collagen, elastin and reticular fibers in the matrix of hyaluronic acid, dermatan and chondroitin sulfate. Now the question which is asked here is that which among these is the most abundant fibers present in dermis? Answer is collagen fibers. So collagen fibers are the most abundant fibers present in dermis. If they specifically ask you that which type of collagen, then remember type 1 and type 3. More abundant is type 1. Okay, so dermis have type 1 and type 3 collagen fibers. Type 1 is more abundant than type 3. Okay, this is around 80%. This is around 10 to 15%. So their ratio can be as high as 8:1. This question was also asked that what is the ratio of type 1 is to type 3 collagen in dermis? It is approximately 8:1. Then the dermis can further be divided into two layers: papillary dermis and reticular dermis. The upper superficial dermis is papillary dermis, which constitute upper 1/10 portion of the dermis, while the remaining 9/10 portion of the dermis is reticular dermis. Okay, so superficial is papillary, deeper is reticular. If you forget this in examination hall, you can very easily recall which one comes alphabetically first. P comes first. So papillary superficial, reticular deep. Then there are vascular plexus which are present. Vascular plexus, because the dermis is richly supplied by blood vessels, these blood vessels form two plexus. The first plexus, which is superficial vascular plexus, it is below papillary dermis, and the deep plexus, deep vascular plexus, is present below reticular dermis. Okay, so in between papillary and reticular dermis is the superficial plexus, and below reticular dermis is deep plexus. Okay, so these are two vascular plexuses which are present. In dermis there are various cells which are present. Among them, the most abundant cells are fibroblasts. So fibroblasts are the most abundant cells. Then other cells which are present are macrophages, mast cells, now these mast cells are very important because when they become defective, they might lead to certain disorders. So these are two important disorders which you need to remember here. One is urticaria pigmentosa and other one is simply urticaria. Both are different disorders. Both are related to mast cells. Urticaria pigmentosa is a type of cutaneous mastocytosis. Cutaneous mastocytosis, while urticaria is due to hyperactivity of mast cells. So urticaria is due to hyperactivity of the mast cells, while urticaria pigmentosa is a type of cutaneous mastocytosis. Now what does this means? Cutaneous mastocytosis. Cutaneous means skin, masto is for mast cells, cytosis for excessive proliferation. So excessive number of mast cells are present in the skin. Okay, so when excessive number of mast cells are present in the skin, what happens? This dark, that is hyperpigmented, generally these are small localized areas, so macules, so dark hyperpigmented macules usually develop over trunk, and this condition is common in children. So this is the clinical presentation. What you will get? Dark or hyperpigmented macules over trunk in a child. Okay. Now let us consider that this is that dark hyperpigmented macule over trunk in a child. Okay, so this is a lesion of cutaneous mastocytosis, that is urticaria pigmentosa. Okay, now if you take any blunt object and rub this, so if you rub with any blunt object, and what you are rubbing the lesion, the skin lesion of urticaria pigmentosa. So if you take a blunt object and start rubbing this lesion of urticaria pigmentosa, what you will find, because there is excessive number of mast cells present here, they release histamine, and due to histamine what happens, vasodilatation occurs. So this lesions become erythematous, edematous, sometimes vesicles might develop. So this change occurs, that is when you rub the lesions of urticaria pigmentosa, that is cutaneous mastocytosis, with any blunt object, these mast cells release histamine, causing vasodilatation, leading to erythema, edema or vesicular formation. This is known as Derriere sign. So many times this question have been asked. This question was asked in NEET, then it was repeated in JIPMER. Many times this question have been asked that Derriere sign is associated with which of the following condition? Answer is urticaria pigmentosa. So in urticaria pigmentosa, Derriere sign is seen. So remember this point, okay? Now coming back to urticaria, urticaria is due to hyperactivity of the mast cells. So here the mast cells are normal in number. In pigmentosa, they were increased in number. Here they are normal in number. Because they are normal in number, you won't find any dark lesions. So skin is perfectly normal. So you will get normal skin. But there is one problem in this normal skin, that is the mast cells which are present in normal number, they are hyperactive. Okay, so with a small trigger or with a small stimulus, they might get activated and they might release histamine. Okay, so even a small stimulus can lead to hyperactivation of these or release of histamine. Okay, so if this is the normal skin, let us consider this is the normal skin, and if you rub this normal skin of the patient with the blunt object, so what you are doing, you are simply rubbing the normal skin with the blunt object, and because in this normal skin the mast cells are hyperactive, they release histamine. So wherever you rub, let us consider that you have drawn two straight lines. Okay, so where you have drawn these two straight lines with this blunt object, you will find here erythema develops and they become red, and wheals develop, edema develop. This is known as triple response of Lewis. What is triple response of Lewis? That is, three things will happen. Wherever you will rub, three things will occur. First, erythema, followed by flare, followed by wheal. Erythema is due to vasodilatation. Flare is due to axonal reflex, and wheal is due to increased permeability of blood vessels. So this is known as triple response of Lewis, that is erythema followed by flare followed by wheal. So wherever you will rub, first due to vasodilatation erythema will develop, followed by axonal reflex, that is leading to flare, and then wheal due to increased permeability of the blood vessels. Okay, now this is known as dermatographism. This is known as dermatographism. So these two are very important points to remember. Derriere sign is seen in urticaria pigmentosa, and dermatographism or dermographism is seen in urticaria. So what is dermographism? Why we call it dermographism? Because dermo is for skin and graphism is for write. So wherever you write, wherever you rub with the blunt object, there the skin becomes, these triple responses seen, skin becomes red and elevated. So that's why it starts appearing over the skin. So if you draw A, you can see A elevated over the skin. If you write your name, you will find your name elevated over the skin. So whatever you write becomes visible. So this is known as dermographism. Next is subcutaneous layer. I already told you various names of subcutaneous layer. This is also known as subcutis, hypodermis because it is below dermis. It is also known as paniculus. So these are various names of subcutaneous layer. Let us consider this is epidermis. This is dermis. Below dermis, you will find subcutaneous layer. In this subcutaneous layer, you will find these lobules which are having lot of fat. So these are fat lobules. And they are separated via septa. Together, they form subcutaneous. This subcutaneous layer generally overlies muscle or fascia. So you can see epidermis, below epidermis is dermis, and then is subcutaneous layer. Subcutaneous layer mainly consists of two things: lot of fat in the form of fat lobules, and it is separated via septa. So septa and fat lobules together form subcutaneous layer. Now can you tell me what is paniculitis? Itis means inflammation, and paniculus, I already told you, subcutaneous layer. So inflammation of subcutaneous layer is known as paniculitis. Okay, so this paniculitis can be of two types. It can be septal paniculitis and it can be lobular paniculitis, because paniculus have two portions, lobules and septa. So when this inflammation is restricted to septa, we call it septal paniculitis. When it is in the lobules, we call it lobular paniculitis. The example of septal paniculitis is erythema nodosum, while the example of lobular paniculitis is erythema induratum. The clinical presentation of erythema nodosum is erythematous nodules over shin, that is anterior leg. Here also erythematous nodules are seen over calf, that is posterior leg, which do not ulcerate, which may ulcerate. So this is the clinical presentation. Erythema nodosum present with erythematous nodules over shin, that is anterior leg, which do not ulcerate, while erythema induratum, which is a type of lobular paniculitis, involves the posterior leg, that is the calves, and there they might ulcerate. Initially they might be erythematous nodules, but they might ulcerate. So this is the clinical presentation. Erythema induratum, the full name is erythema induratum of Basins. So this is also known as Basins disease. So these are few points which you can remember. Here the sites are important. This is generally present over anterior leg, while this is present over posterior leg. Okay. If you forget this, this can also be very easily recalled, because you can see erythema nodosum is septal paniculitis, while erythema induratum is lobular paniculitis. Lobules have lot of fat. So in your leg, because the site is leg, in your leg the fat is mainly present where? On the anterior part of the leg or posterior part of the leg, in the shin or in the calves? In the calves. So that's why in the calves lobular paniculitis occurs, that is erythema induratum, while in the anterior part septal paniculitis occurs, that is erythema nodosum.